I'd like to speak to you now a little bit about injury prevention and the prevention of violence. All right, and here I'm really talking about domestic violence. Okay, so suicide is a major problem and is a leading cause of death in adolescents. So if you have an adolescent patient, a young adult patient, you need to ask about depression and suicide. Does the patient feel sad? Does the patient feel hopeless? Does the patient feel guilty? Has the patient lost interest in activities that he or she usually enjoys? Right? Is the patient having a hard time concentrating? Does the patient feel sad or hopeless? Does the patient have a plan to harm themselves or kill themselves? Would be a key question. Do you have any thoughts of harming or killing anybody else? Is a good question to ask if they're homicidal towards anyone else. So if you find that the patient is depressed, appropriate referral and treatment is appropriate. So be especially concerned about suicide in the teenage years, and again be concerned about suicide in adult patients who live alone, who have some medical problems, no social support network. These are also patients that are prone to suicide. Okay. It's appropriate for the physician to talk with their patients about car safety. All right. Not only should children be in the appropriate size car seat, but adults simply should wear their seat belts. That's the main thrust of your discussion. The patient will say, "I don't want to wear a seat belt," and you will say, "The seat belt helps you from hitting your head on the windshield, and brain injury is still very difficult to repair." Okay? You should discuss with your patients about fire safety. They need to know, you need to recommend to them that they have smoke detectors and carbon monoxide detectors in their homes and apartments. All right? Okay? Domestic violence is all too common, and it should be part of your routine screening questions for periodic health exam. Don't forget that domestic violence can happen to husbands also. There's battered husbands just as well as battered wives. You need to bring this up and say to patients that you can help keep them safe if they are a victim of domestic violence. And you should ask all patients if they feel threatened by anyone. If they say yes, you'll get them more information and you'll send them to the appropriate counselors. Okay? You know, the patients who are victims of domestic violence, they tend not to want to tell their physicians unless you've shown a great amount of empathy and concern for the patient's well-being. And if you don't tell the patient you can help keep them safe, they won't tell you because they're afraid they'll go home and then they'll end up looking like this. So here we have a picture of, I guess, someone beaten up on the street. So there's larger societal issues of how to prevent violence in our society, and that's a very complicated topic, and they're not going to be asking you that on Step 2 CK. That is the end of our discussion on the prevention of violence and injury.